Today I'll be discussing about the bronchial asthma. First, you should go what is the definition of this bronchial asthma. To stay awake in order to breathe or difficulty in breathing. It's a chronic inflammatory disease like more than 6 months. It will persist. Symptoms like breathlessness, chest tightness, both at night or in the early morning. See, these slides I made for my seminar, so much information is given. I'm not going detail. Whatever is needed for exam point of view, that much I'll discuss. Types of asthma: extrinsic asthma, intrinsic asthma, status asthmaticus, and cardiac asthma. In extrinsic asthma means how they'll diagnose: serum IgE level they'll check, and also skin test they'll do. Skin test means band-aid like thing. It contains an allergen. They're going to paste it one place and they'll tell the patient to come next day. After 24 hours, they see if there is an itching, redness, swelling. Then they'll take it as a positive. If there is no itching, swelling, redness, then they take it as a negative. Negative skin test, you'll see. Like in case of intrinsic asthma. Status asthmaticus, this is important. Like physiotherapy student, you may get 5 mark question with this. So what are the symptoms? You should know like what is the treatment of this status asthmaticus. That I'll come to the later. Exhaustion, cyanosis, bradycardia, hypotension, dehydration, metabolic acidosis. Cyanosis means bluish discoloration of the body. Metabolic acidosis, acidic ion like bicarbonate and other acid level will be, acidic ion or acid level will be more. Cardiac asthma, you will see in case of uncompensated congestive heart failure. I told previous class what is uncompensated congestive heart failure or uncompensated heart is unable to maintain the normal cardiac output. Is nothing but this is the picture showing how the asthmatic bronchiole looks and the normal bronchiole when compared to there is so much congestion in the alveoli due to deposition of the sputum. Coming to the classification, this is important. You get a 10 mark question. Physiotherapy and nursing students. Classify drugs used for bronchial asthma, rate mechanism of action, uses and adverse effects of methylxanthines. This class of drugs they'll ask. We'll come to the classification. We'll go one by one. Bronchodilators we have in the subclass sympathomimetics. Drugs in this classes: salbutamol, terbutaline, bambuterol, salmeterol and formoterol, ephedrine. So this sympathomimetics they may ask for 5 mark question also. You should know. Methylxanthines, this will come usually 10 mark question. Theophylline anhydrous, aminophylline, choline theophylinate, hydroxyethyl theophylline. So this theophylline ethylolate of piperazine, it should come in one word, and doxophylline is another drug. I'll repeat once again. Hydroxyethyl theophylline is one drug, theophylline ethylolate of piperazine is one drug, and doxophylline is another drug. Anticholinergics you studied in ANS. We have here only 2 drugs, that is ipratropium bromide and tiotropium bromide. These are given in a inhalation route. We have leukotriene antagonists like montelukast, zafirlukast. Montelukast is the more commonly used, like along with this levocetirizine, Montelukast, LC-Troy, like different combinations are coming. This is given for the prophylaxis most of the cases. Next we have mast cell stabilizers, sodium chromoglycate and ketotifen. Sodium chromoglycate again commonly used in an inhalation route. Next we have corticosteroids, systemic like hydrocortisone, prednisolone. Either parenteral route or the oral route they will give in case of emergency, or sometime for lifelong treatment also they will give oral treatment. Inhalation we have beclomethasone dipropionate, fluticasone, budesonide, flunisolide, cyclosinide. So these are the more commonly used. Inhalation corticosteroids are the more commonly used in case of inhalers. Like we have rotainhaler, meter-dose inhaler, nebulizers, like that different inhalers we have. In that case, they'll use any one of these drugs. And last one is the anti-IgE antibody, that is omalizumab. This is very costlier, but we have this treatment also. Routes of drug delivery system, we have three routes we can give the drugs for treatment of bronchial asthma: inhalation, oral and parenteral, depends on the condition. Cromolyn, sodium, anticholinergics, corticosteroids, I already told, these are given inhalation route because they have a rapid onset of action, like fast, because when you give inhalation directly it will reaches the alveoli. There is no much side effects also, because when the patient exhale, once the action of drug is over, it goes out through exhalation or expiration. Here particle size is important, like if the particle size is smaller, then only it can able to reach the smaller alveoli. If it is bigger, then they get deposited in the oropharyngeal region. Particle size, how much it should be, like 2 to 5 micrometer optimum, and small airways it should be 1 micrometer. This meter dose, like inhalers we are using propellant, like just a binding material kind of thing along with the drug. That is, earlier days we are using chlorofluoroalkanes, chlorofluorocarbons, but nowadays we are using hydrofluoroalkane, because chlorofluorocarbon it's destroying the ozone layer. You can see, like it's present in you, even in your refrigerators also. To prevent that, we are using hydrofluoroalkane. It is ozone friendly. So these are extra information. Nursing students, you may get question like inhalation devices. You should know what are the inhalation devices. We have 3: meter dose inhaler, spacer mainly we use for children's, and dry powder inhaler, nebulizer. You can go through, it's not a complicated one. The next one is the oral route. Oral dose is higher than the inhalation dose. It should be like in 20:1 ratio. Here side effects are more when compared to the inhalation one, but few patients will still prefer, like small children's, patient with physical problems, usually will go for that. And the more commonly used to oral route is the theophylline. The drug comes in Derphylline injections also available, and even tablets also available. The next route is the parenteral route. I told already, only severe ill patients will go, and chance of side effects is more because it like when you inject into a vein, it attains higher plasma concentration. That's why I'll continue with the next PPT. Thank you.